Good morning, everyone. Yes, definitely. I need to switch to English because, I could try German, but we all are going to be tired with that. So I will do this in English. So let me share my screen with you, and I would need vocal confirmation if you can see that.
Yeah, we can see
Perfect.
it.
Thank you. So a little bit about myself. I am Paulina Lewandowska. I work for Roche. I'm in a global informatics setup based in Switzerland. I'm with Roche for 14 years already, mainly in the commercial area, but also doing various roles and being in different functions. And last 4 years, I really dedicate my time to experiment and innovate in the area of conversational interfaces, mainly in the space of patient empowerment. And this is what I'm going to speak today about. But before I start, I would love to introduce Roche. I believe Roche is known, especially here in Switzerland. But Roche is a global pharmaceutical and diagnostic company, and we do have a quite long history in advancing science to bring novel treatment and diagnostics to patients. We really try to be innovative in that approach, and we are super proud of being a leader in investing in research and development in a healthcare space. So last year, we invested 13.2 billion Swiss franc in that space. So we do that everything because of the healthcare challenges. And I really want to bring those challenges to your attention. I believe being here, we are more or less aware about those challenges, but it's super important to really always remind us what actually drives all the innovation and all the work we try to do behind. So the number mainly come from WHO organizations, so you can always revert there, see them. But what is really important, we are really aging as the population. So by 2050, the estimated number of people over the 65 years will triple to what we have there. So this is like a huge challenge for healthcare environment. Also, a lot of people still does not have a proper access to essential healthcare services. And last but not least, the chronic diseases are really a big challenge nowadays. So annually, the chronic diseases causes more than 70% of deaths globally. So the diseases like diabetes or lung respiratory diseases really are the killers here. So if we think about a patient journey with a chronic disease, so I'm not sure if all of you were able to attend Marcus' presentation before. I tried to understand some stuff there, but it's really very, very similar approach, which I can show you, but I am really focusing here on patients. So really trying to show you the journey and possible digital points, digital interaction points within this journey. So if you think about the journey in the chronic disease, don't picture it like, vacations on a tropical island. The disease and the journey is really emotional with a lot of ups and downs. Patients and the caregivers, people who really try to support patients, really have a lot of emotions around it. Even the diagnosis itself can be something which is a relief. I have multiple sclerosis, but I don't have a cancer, or can feel like sky is falling. And even going from one of the stage, from prevention to diagnosis or diagnosis to treatment, it could take years. So this is super exhausting journey. And usually what patient needs data, information, support, someone to talk to, or everything what really could make this journey a bit easier. And here I want to give you a perspective how actually conversational interface can be embedded in that journey. Some of things are actually happening already. Some are, I would say, more futuristic, and I would love to also speak about them to be a more kind of inspirational in which direction we could go. So conversational interfaces, we could name chatbots, more like text-driven modalities, but also voice-operated, also digital humans, so these avatars which are similar to real person. And if we start from kind of the beginning of this journey, let's say we have automation. So patients can schedule a visit, patient can ask for the refill of the prescription. There might be a triage process done through the conversational interface when you are entering an emergency room. And those automations are already quite present in the implementation. The one problem with that is that usually if we think about prescription refill or the booking the visit, they are really connected to either specific praxis or to the specific hospital. For patient, there is no one experience that you can book the visit with whichever praxis or whichever doctor you want to. So already the experience is a bit difficult for patient to navigate. Another thing is to go a little bit farther, so to manage the disease. And if we even enter there, currently there are not so many applications, especially here connecting to the conversational AI, which fulfill that space. The best known are in the area of the diabetes care and mental health and well-being. They are still not kind of available for the like the broader population, because what has been proven, people really like to interact with the voice way of working, and sometimes voice is really better than the text. And this is still a challenge, how to design properly for this voice interaction. And again, here comes another app. So as patients, you need to navigate through really quite a maze of different applications and different interfaces. Even if it is a conversational interface, they are still designed differently. So that's one space. But what if, and then we go to the diagnostics assistants, what if you have your voice assistant like Alexa or Google Home really being embedded in your daily life, and you interact with this assistant. You interact on daily basis. You ask, where is the restaurant which you can really enjoy being on the wheelchair, or what is the administrative burden to have like the reimbursement for the wheelchair which you just bought. And during this interaction, using, for example, voice, the assistant could detect some changes in your voice signals. And obviously, it's not about saying, "Oh, you are diagnosed. Something is wrong with your disease," but rather to be bridging the patients and the doctor, maybe flagging. Perhaps this is a good moment to have a visit to your doctor, to have a checkup, and to better understand what is happening with your disease. So there is a broad spectrum of different use cases. The one which I just shared with you is kind of a future still. But if we want to go there, we need to properly start to prepare ourselves from technology perspective, understanding patient needs, actually understanding an ecosystem perspective, because this is not like patients themselves. This is not like the doctor is the only one in this aspect. This is like the whole ecosystem, which is totally different from country to country, from the insurance perspective as well, and healthcare system as well. So everything is super complicated here. But to be there, we have to start somewhere. So it's really about selecting specific use cases. And today I'm going to tell you about one of our experiments we did in Belgium and how it started. It really started not from the solution. Oh yeah, let's do the voice assistant for patients. It really started with a need. So the Belgium affiliate were really in the discussion and collaboration with the healthcare and ecosystem there. And they figured out after discussion that patients, and specifically recently diagnosed patients, really are overwhelmed with the diagnosis of the multiple sclerosis. And multiple sclerosis is a neurological disease when actually the immune system eats up the protective cover of a nerve. So it means that the nervous system is impacted and the symptoms which are appearing through the whole life of the patients are not clear. So even one patient can have totally different symptoms than the other patient. And as a doctor, when you have a newly diagnosed patient who already most probably have been for a long journey with the diagnosis, because this disease is not easy to be diagnosed, you can't just inform about every potential symptoms you can have, because this is super overwhelming and patient is already feeling super lost in this situation. And also healthcare professional during this time of the diagnosis needs to focus on thinking about treatment and not necessarily have a possibility to hand all the information with patient needs. Of course, in some countries, even in Belgium, they have some additional personnel who help them navigate patients through this disease. But it also depends on the peripheral center or the bigger clinic. So everything depends. And patient is actually alone, a bit lost. The specific patients from the MS really can be so different, and the visit between the visits which patients have meanwhile with the neurologists are scheduled between 3 to 5 months. So you might not, as a patient, even remember the specific symptoms. So with actually that, the Belgium team sit down together with the ecosystem, with technologists, and said, perhaps a good idea would be really thinking about something which is not intrusive and can be embedded in a patient's life and allow patients to interact and ask questions, specifically here about the silent symptoms, whenever it's needed. The first idea was to enable the voice modality only, but as a technology team, we also advised to little bit not limit ourselves, because the technology is still not super mature in a way and in a creating really great experience from the patient perspective. So we advised to build a multimodal application. We built web application to really limit another hurdle to patient to understand if they have either iPhone or other type of the system, so that it's easy to manage from the technology perspective. And we really also wanted to make sure with that people will operate it with their own language, which is Dutch and French. And of course, in Belgium, people speak in Flemish, not in Dutch, but this was the only possible language which we could choose from our technology stack we have available. So we did this kind of the interactive design, because what I am going to say today more, it's about the design. So really including all needed information from users, from stakeholders, from people who will benefit the assistant. And because in the design, you really need to understand what are your discovery goals, because we still talk about pilots, experiment, understanding how this can be used actually. We set up our goals. So we really wanted to understand if the voice is the right modality, because we were not sure which one actually would be preferred by patients. If the assistant is the right channel, because we could create a web page, for example, or maybe an app, but we have here the comparison to the web page. If actually the whole collaboration with the ecosystem, the healthcare ecosystem, will somehow boost the interest in this type of technology to be used. So this is from one aspect of the design. And second, actually, two additional part is really about the disease management. We really wanted to see if patients change their attitudes toward the disease and if they feel empowered really to make some actions in terms of the disease management. And I want to be very specific, it's clear. This assistant was not meant to be a diagnostic tool. We really wanted to somehow help patients to understand their symptoms and to have better discussion with doctors. So this is actually how I also see the role of those assistants, not like exclude doctors, but really to be another side of this conversation between patient and doctor to really help this conversation to be better. And last but not least, of course, from our goals, was really still to check if we can improve the voice capabilities and understanding capabilities from the Dutch and French perspective. One remark, we started our designing of our pilot and we actually launched our pilot in the middle of changes in the world, meaning before the ChatGPT has been announced. So at that time, and we were using the NLP platform. At that time, we already been perceived as someone innovative. Meanwhile, the ChatGPT appeared, so of course it also changed the way how possibly it could be designed from the beginning. So a little bit about the designing process, and I know I'm almost on time, sorry. So we really focused very much on the needs. So we were able to have the proper conversation with patients to properly scope our persona and properly adjust the content to the assistant. And I wanted to mention that for us, it was important that we could apply the Conversational Design Institute framework. We started with few people with a different maturity in conversation design and designing for conversational interfaces. And we decided to go with the framework. We all took the courses, and then it was easier to us to really speak the same language. So once we have it, once we design it, once we develop it, we wanted to obviously check our goals. So we decided to go for the 6 months of usage. And after those 6 months, we also did a user testing and UX validation with other users. So with the users who were not included in the first pool of the usage. So from the usage, we really wanted to understand the acceptance, proactiveness, openness in communication, and which modality actually is preferred, and also if the content scope is proper. From the user testing and UX evaluation, we really wanted to check if really the expectations of the disease management and understanding is there. What is the experience, adoption, and satisfaction? So we do a questionnaires, we do some 3 behavioral scenarios. So we ask really a pool of users to do so. And how it went. So we have proved few of our hypotheses. So first of all, yes, majority of people choose voice modality and they really preferred to have it. After also the testing, we ask a lot of questions about the channel, which is the assistant. And actually, people said, yes, this is what we want to do. This is non-intrusive. I will go there whenever I want. Maybe it doesn't work now super great with the voice because, now we want to have the experience like ChatGPT has. So this is something which you can still improve, but actually we want to really do this that way. And really, the collaborative approach really helped us with the recruitment. We were having around 70 people being recruited to the platform and using it, but not using this so much as we wanted, and we couldn't prove and validate anyhow our hypothesis about the change in the attitude, because that was a set of questions which appeared every now and then, but it requires some interaction from patients. But patients actually didn't interact that much, and we know why. Again, the way how we design it, it was still using the NLP, not generative AI. So we had some limitation, and we also had some limitation from the resources perspective, which we dedicated to it. So we didn't have like the full-blown team to do so, but only 4 people. So we did it to the extent which was satisfying, but still for patient, it was not enough. And the same was with the empowerment. So it means, patients said, we want it, this is super, but to be fully engaged and to use this on a daily basis, you really need to focus and somehow make sure you can provide a bigger scope of content. This still should be more engaging as we are not now used to. And of course, the voice capabilities need to be boosted. So this is something to be worked on. And as you can hear, we have now the point where we need to figure it out how to do this further. Generative AI is an option, but it has a lot of risk now. We are not fully sure if we can go as it is. So before we go further, we need to have all the discussion around, of course, ethics, of course, the risk, of course, the data, transparency behind. But that's my last slide, and that's my ask for everyone who is going to experiment more or wants to shape the future of the healthcare. It's really the way how actually it can be shaped for tomorrow's future. So really, even if there are still some harder trying to overcome, of course, together with the ecosystem, because it's not like, doing a standalone solution. It's something which needs to be discussed and design together. And that's all from my side.
Oh, thank you, Paulina, for this really interesting presentation. Lots of information. We have actually one question coming from Dominic again. Will you start the second test using generative AI?
Yeah, so as I said, we see that at least, from our side, using, I would say standard NLP, but I feel like standard NLP is still, so was not a standard at certain point of time. Would require really a kind of a big team, big effort. Not that Gen AI not, but it also enabled this part which we failed a bit with the engagement and better content management to some extent, because of course you need to manage your content properly even with Gen AI. But I think I would also rephrase this question a little bit. If you saw this, actually, it's not like pharma company driving it. It's like an ecosystem topic, right? Who wants to be also in the scope? So I would say we really need to understand how we can do this together, and who can bring what to this solutions. But if you ask me, and you ask me, Dominic, I would say we should closer take a look on Gen AI, but this is not something we would do tomorrow, like meaning tomorrow.
Great, thank you. Another question from Dennis. What problems the user mentioned in terms of acceptance?
I think the biggest challenge to them was really high expectations, which I love, because we really tried to prepare to that topic. With the research we did, we had our personas, we have our different types of patients there. We knew what type of content we should brought, but still it was not enough. So content is a queen, I would say. And not only the content we might feel relevant, but the content with patients feel relevant. So that's why I also speak in the beginning on where can I find the restaurant? What type of documents should I fill, right? Because this is kind of a one experience tool. Why should I go to different multiple sclerosis tool to have a different questions? Because this doesn't make any sense. So that's the main one, and the second is definitely with the voice. So because we decided for the web app, it's a hardware specific as well topic, right? So people use different types of hardware, and of course, native app could resolve it to some extent. Yeah.
Cool.
So
Thank you.
that's the main challenges.
Thank you. I hope, Dennis, we answered your questions. We have two more before we definitely jump into the networking area where you can ask as many questions as you want to Paulina. But Ekaterina had one. Is it currently a standalone solution?
I'm not sure if I properly understand the question, so I might wrongly answer it. So, Katarina, please feel free to jump to the networking session. But it was in a cloud solution, actually, and the patient has the access anonymized. So they have a QR code with which every kind of login has created a new QR code. We knew it, so meaning if you have two devices, you will be like two patients, which is fine for us. But we really didn't want to track the any personal data with it. And this is like distributed to patients, so everyone could use it. It's closed already, just to be fair, but for the period of the 6 months, it was open.
Okay, thank you. So last question, really last question from Christian. You mentioned on the slides software as a medical device. How do you judge generative AI models to become FDA approved?
And that was also the disclaimer to the software as a medical device, saying that was not our purpose. And I'm not sure as a designer if I'm going to go in that direction with Gen AI, at least from today's perspective, to really design for software as a medical device in that space. So my personal doubt for today is I don't know. I would be really conscious about it. So I assume FDA as well. But I can imagine the technology is moving so fast that everything is possible. But
Okay.
again, from my personal perspective, again, this tool should be so the way how I see it in the future should be still more helpful in the discussion. Of course, we could think about the software as a medical device, but I think even now we should carefully think about how you position the digital solutions with this ecosystem environment.
Oh, great. Thank you very much for your feedbacks.